this is where this is one type of thing. Morning I showed a total gastrectomy. Exactly, no difference between laparoscopic robotic and the principles of lymphadenectomy or gastrectomy. But Koreans doing extensively gastric cancer. Everyone, most of the experts are doing more than thousands by individually. So they are today leading this way, like Chinese, Taiwan, Koreans. But unfortunately, number-wise, we cannot claim now. But I don't do gastrectomy by robotic because of the cost. But if it is available, cheaper, equal to, I am sure. But from next week onwards, we will be doing more number of cases because trial, it is free, so I can do any number of cases. Next 5 months, we will do as much as possible to show the results how it will be. Any question, I will take it up. I have to go for a flight, I cannot remain back.
I think Palani, before the audience asks, so now for the youngsters, so is there any situation where you say, okay, this is not suitable for a lap or robotic, this is for open? So is there any situation where preoperatively you decide that this patient should go for open? I know you can do anything.
But if you ask me robotic to laparoscope, I would have answered very well. But if you ask me, laparoscope.
So for a young surgeon should be, when they started a career, which are the cases where they should?
Yeah, this is a very important question every surgeon should know. And you may land up at any time vascular bleeding and problem. You must know how to convert and get it done. Very important. But once you learn properly, some places, in fact, I want of time I did not show, I was doing a total gastrectomy robo. When doing it robotic, that case planned. Already there was multiple nodes, peritoneal, hypec given twice, then went down, and the splenic nodes was firm, and the pancreatic tail, everything hard. There also, a slight attempt, it was actually bleeding. But minimum bleeding, so left hand I can hold. Distal pancreas and the spleen we removed by stapling and continued anastomosis. So, in that case, I converted into laparoscope, not open, because laparoscope you can put a trocars anywhere, number of instruments more helpful. So conversion means robotic laparoscope, we don't convert to open, we never land up because after so many cases done. But open is, conversion is very important, and in case of complications, mostly it is a bleeding. One of my colleagues was doing it, initial like a duodenal mobilization, nodal clearance, common hepatic artery, went and make injury in the portal vein. So there the portal vein, difficult with laparoscope robotic, not possible. Better put a gas piece, press it, get open and get it done. That case we did open and managed it. Portal vein injury can happen when you are doing a nodal clearance, that is important. Arterial bleeding is very rare, but still that's also possible, very important and very, very careful.
Sir, we would like to do sampling of the paratic nodes if present, robotically, while that will come at later part. But we decide operability of the carcinoma stomach based on the paratic nodes involvement. So would you also do sampling of those nodes before going for a gastrectomy?
Yeah, before nodal
sampling.
That is always. For example, if it is peritoneal nodules biopsy, then you have to go for chemotherapy coming for surgery. Similarly, you got a doubt. Many of the Indian population, the nodes enlarged does not mean secondaries. And PET scan you did not show pickup, but still when you do laparoscope, doubt enlargement is there. Then take a node, look for biopsy, then continue that. If a positive, unnecessarily non-meddle it. Now chemotherapy is so available today, all listen morning to evening, so much discussed. Then if you go through, then the problem will not be there. Many cases we are done after chemotherapy, advanced stage, operated, patient living 20 years, that means that is possible, but should not operate at the time. If you operate, the patient will come soon with the peritoneal secondaries all. Biopsy very important before deciding. Your surgery must be complete removal.